I'm Crystal Perkins. I'm a pediatric orthopedic surgeon. My specialties include sports medicine and trauma, and I'm also the director of our orthopedic quality and outcomes. When you're deciding where to take your child or teen athlete, there are a lot of choices in the community. But I think it's important to understand the things that distinguish children from others. Not all sports injuries will require surgery, which is why it's so important to see a pediatric sports medicine specialist who understands what makes sports injuries in teens different from sports injuries in adults. And our sports medicine program is really centered and designed around understanding the teenage athlete. Oftentimes, a doctor's visit can be intimidating or scary for patients in that age. And they're afraid, especially from an athletic standpoint, that you're going to take away the one thing they really love the most, which is their sport. Understanding why they're motivated, why they want to get back, and the demands it takes of their sport to get them back on the field. It improves the connection and improves their trust for the physician that they're working with. There are several qualities of our sports medicine at Children's that distinguish us from other places, which includes experts who are fellowship trained in sports medicine, specifically pediatrics, who have experience in the breadth and depth of pediatric sports medicine. We do a lot of clinical research here, and the goals are really to answer the question of how do we best take care of your child so that when they are getting back to their sport, they have the lowest rate of getting re-injured? How do we get them back on the field fastest? And how do we try to ensure that they're performing at the highest level possible? How do we try to ensure that their joint that they've injured functions best as a teenager, but also as an adult? I grew up playing soccer, and then during college, I was a runner. And then during medical school, I took up triathlons, and that's what I continue to do today. An average adult, maybe a weekend warrior, plays sports periodically, but our teenage athletes have risks that they're exposed to on a daily basis because they play soccer or basketball 7 days a week. We have experts who specialize purely in pediatric sports medicine that take care of pediatric and teenage athletes all day, every day. Children's is Georgia's only nationally ranked program for teens and one of the only programs in the country dedicated exclusively to caring for growing athletes.